treatment involving ozone?
Ozone?
Yeah.
No. But I don't read this kind of, you know, all the literature on this, so maybe there has been, I don't know. No.
Most doctors believe that if you put a gas, especially ozone, into your being, that you would drop dead within minutes. I guess I'm a case in point where over 2 years I've had an awful lot of ozone going into my being, and I certainly haven't dropped dead.
I think I was in the world the first physician who treated AIDS patients with ozone. It's now since more than 6 years, 7 years. And my first patient, they are living in a good situation. They are doing very, very well. They are working.
Now, this is lunatic medicine, and I really won't pay any attention to it because it's absolute lunatic. The clinical studies in relation to ozone are absolutely uncontrolled. Some of the procedures they've described are grossly unethical, and you'd never get permission to replicate them in a Canadian medical school. Extremely dangerous things to do, and without any evidence of benefit.
Ozone therapy is a controversial medical treatment that uses pure oxygen and a tiny amount of ozone to treat a variety of medical conditions, including cancer and AIDS. In Europe, several million people have already been treated, while in Canada and the United States, the treatment remains illegal and largely unknown.
Well, I had an ozone generator, and we used it on all our AIDS patients, just about all our cancer patients, and we used it on the yeast patients, which really was the largest group. Generally, we gave it intravenously by what's called autohemotherapy, where we pulled the blood out, mixed the blood with the ozone, and in a few minutes gave ozonated blood back to the patient. We found that our cancer protocol, which included ozone, was effective and was keeping people with so-called terminal cancer alive and without ever having to require pain medicine, without losing weight, without any sign of deterioration. And then when we lost our ozone machine, the patients began to go downhill. The FDA saw to it that our manufacturer had to take away the business end of the machine, so that we no longer had an effective ozone generating machine. And that's where we are right now, currently. I'm right now trying to figure out how to get around that, because I believe that my patients very much need ozone.
Ozone is simply an energized form of oxygen. It is created when electric or ultraviolet energy causes oxygen atoms to temporarily recombine into groups of 3. The newly formed molecule is unstable and quick to react with other substances, a powerful oxidant which can inactivate bacteria and viruses. Its first commercial use was to sterilize polluted drinking water in Europe almost 100 years ago. Today, more than 2,000 cities around the world, including Paris, Montreal, Moscow, and Los Angeles, use ozone to sterilize their water supplies. Oxygen and ozone are bubbled through the water, killing bacteria and viruses, reducing odor and taste, and leaving the water disinfected and safe to drink. But ozone is also controversial. While ozone occurs naturally as the protective layer surrounding the Earth's surface, it is also the gas that is formed when sunlight reacts with air pollution in our cities. Scientific studies in North America have focused on the negative effects of ozone on breathing. As a result, many doctors have assumed that ozone has no medical application.
I was shocked to discover that people travel to various clinics in Germany from, virtually all over the world, and paying between $2,000 and $3,000 cash on the table American for 6 treatments. It's just incredible. So here I'm faced with a range of potential clinical applications. A huge number of people are using it. a patient base that's worldwide paying big money for something, there's got to be something in this, you know. But what is it?
In Germany, for the past 30 years, ozone therapy has been used to treat over 40 different medical conditions, from eczema and gangrene to cancer, strokes, and viruses that cause such diseases as hepatitis, herpes, and AIDS.
I paid my own way just to go to Germany because I couldn't believe that these things could really be true, you know. Even though I'd been reading all this literature and stuff, I couldn't believe it. But once you go there and you see in his clinic and you see all these patients who've been coming for 5 years or 10 years or 20 years and told that they were going to have their leg amputated, you know, 10 years ago, and here they are perfectly hale and hearty, or people who've had herpes, zoster, or hepatitis or something and been treated and said that, you know, they'd had this disease for years and now that they're so much better. It's difficult to deal with answering those patients, particularly when they say, "Oh, you're the clever, you're from America and you're so advanced over there. How do you use ozone?" And you have to say, "Well, we don't use it in treatment at all. We only use it in animal experiments or whatever." You know.
In addition to bubbling oxygen mixed with ozone through the blood, the treatment can also be applied externally for burns, wounds, and other skin conditions. The most controversial method is direct injection of the gas combination into the body to treat a variety of internal disorders. The medical potential for ozone therapy is based on the relationship of oxygen to human cells. Essential for every human cell, oxygen produces energy for healthy cell activity and acts directly against foreign toxins in the body. Ozone therapy accelerates the oxygen metabolism and stimulates the release of oxygen atoms from the bloodstream. When levels of oxygen in the body decrease, the potential for disease increases. In 1966, Nobel Prize winner Dr. Otto Warburg confirmed that the key precondition for the development of cancer is a lack of oxygen at the cellular level. In 1980, the peer-reviewed American journal Science published laboratory evidence proving that ozone selectively inhibits the growth of cancer cells. The implications of ozone therapy for modern medicine are enormous.
Whenever you have a disease, ischemic areas, for instance, in your brain, there's a lack of oxygen. And oxygen is very vital. And you can heal, for instance, brain stroke if you get the patient in the first 48 hours. That was one stroke, a second stroke, and the patient had a third stroke. That small spot here is a third stroke. The first and the second one was treated in hospital without ozone, and that one was treated at home with ozone. And since the scars are that small after brain stroke, the patients are not paralyzed. I have a table of 40 patients and nobody is paralyzed. I can give you the table of brain strokes in the United States from 71 and from 90. There were in 90, 750,000 brain strokes. 250,000 persons died, and 16% are so disabled that they need total care around the clock.
And ozone will help them?
If I can count it up from 40 patients, but in 40 patients, nobody was dying, nobody is disabled.
And side effects?
Nothing. No one.
In 1980, a German study surveyed more than 1,000 therapists who had given more than 5 million ozone treatments. 90% of the therapists reported the treatment effective. Only one therapist reported the treatment ineffectual. The study also revealed one of the lowest levels of side effects for any medical treatment.
Sometimes you have a kind of allergic reaction on ozone. But I have seen this only 3 times under 10,000 cases.
Doctors also report that ozone sensitizes the body to other medications.
We can take 50% of the amount of drugs we normally use, plus ozone, and then it works in the same way, but we don't have the side effects of drugs. For instance, loss of hair, vomiting, dizziness, and so on.
Increased oxygen metabolism makes the circulatory system more efficient and stimulates the immune system to better combat disease. In one study of 600 patients facing amputation, ozone therapy reduced the need for amputation by 50%. Other studies reveal greatly improved blood circulation, reduced levels of pain, faster recovery times, and an increased feeling of well-being by the patient. In the last few decades, hundreds of papers have been presented supporting the medical use of ozone. Still, in North America, the treatment remains largely ignored.
Eric Murphy, diagnosed 1984 as HIV positive, and you have had some unusual treatment.
Yes, outside of Munich, Germany, Dr. Horst Kief. It's called ozone therapy, where they take the blood out and ozone it and infuse it back in, thereby sterilizing the blood and bringing me better health than if I didn't have that particular therapy.
Yes. Eric, you're on your feet, you're walking around, you look like all my relatives, Murphy, and we're happy for you. You should also know that this therapy does not get a standing ovation in most of the research community.
That's correct, that's correct. It's unorthodox, but the therapy in my book works. And I'm going back in about 3 more months to have it done for 3 more weeks and come back and live a healthy life and go back again if it's necessary.
What's remarkable about ozone is its simplicity. It's a triatomic molecule. It is really an oxygen molecule and a half in its most simplistic form. And probably there was a lot of research that was done on ozone in the 20s and 30s in this country. And one of the major reasons that it was put to bed, so to speak, or laid back, was the fact that no one had a handle on it to make it a financially followable project. How can you market a gas as simplistic as ozone?
One way that companies have tried to exploit ozone is to patent ozone technology. Several companies now hold such patents in North America. Medizone International is one of them.
We filed with the Food and Drug Administration for the sale of the drug produced by the equipment and its use in the treatment of AIDS. The FDA required that we carried out research to demonstrate non-toxicity and likely efficacy, and that we've done.
The Food and Drug Administration is responsible for regulating all drugs and medical devices marketed in the United States. To date, the FDA has failed to approve any ozone equipment for general medical use.
The FDA doesn't have a bad reputation, certainly in all areas. There's the public, in fact, the public in general is behind the FDA reviewing new drugs and making sure they are safe and efficacious before they're available for sale. Inevitably, we don't do it fast enough.
Despite spending more than $2 million on research at major medical centers to prove ozone's safety and effectiveness, Medizone has still not satisfied FDA requirements. Conservative medicine demands expensive double-blind studies where half the patients receive a placebo in order to determine the effect of the actual treatment. In Germany, where doctors are allowed to use ozone therapy, no doctor wants to give placebos to seriously ill patients.
Perhaps in Germany we have treated, I think, no less in the last 40 years, no less than 10 million people. I think more. Now you have the biggest test with 10 million people. What do you want more?
It's not double-blinded.
Not double-blinded, sure. Yeah, not double-blinded.
The value that this substance has.
Michael Carpendale has conducted scientific research with ozone for 22 years. In 1988, he co-authored startling new evidence presented at the AIDS conference in Stockholm.
We worked on the AIDS virus to try and see how quickly we could inactivate this and at the same time compare it to what effect that had on a healthy white blood cell. And we found that we could produce an enormous inactivation of the virus, reducing it from 1 million virions down to no viruses at all at, say, 4 micrograms of ozone. And twice that dose had no adverse effect on the healthy white blood cell.
Similar findings were also reported by Medizone researchers on the East Coast and by the Canadian Department of National Defence in Ottawa. The military was interested in ozone's potential to sterilize blood infected with the AIDS-related virus. Captain Mike Shannon coordinated the study.
We certainly demonstrated that ozone was capable of deactivating the virus, but to our surprise, right out at the absolute limits of concentration, so 10 to the power of 6 virus particles per cc, we still deactivated everything. So very, very marked demonstration, or profound demonstration of the potential as an antiviral agent here. And of course, we're dealing not with concentrations that are toxic to the human, but in fact concentrations of ozone that have been used in Germany in clinics for the last 30 years with thousands of patients without any evidence of any harm.
Approval was obtained from Health and Welfare Canada to conduct a human AIDS trial using ozone technology from Mueller Medical, a Canadian company.
Inadvertently, we discovered that this particular type of therapy has an incredible effect, a very, very profound effect in terms of managing pain. I mean, it has a very potent analgesic effect. And then secondly, we were able to discover that blood that's ozonized actually triggers off the production of interleukin-2, one of the immune regulators. So here we were sitting on a very simplistic technology that had promise of literally blowing the lid off of certainly North American medicine, or North American pharmaceutics anyways.
Although the secondary findings were remarkable, the trial results were inconclusive and received little media attention. Research continued, and in June 1993, it was announced that Canadian government scientists successfully sterilized blood plasma contaminated with SIV, the monkey equivalent of the AIDS-related virus, using an ozone generator supplied by Medizone International. Monkeys receiving contaminated blood plasma died within 12 to 14 days, while all the monkeys injected with contaminated blood plasma treated with ozone remained uninfected and healthy. The Canadian project has now spanned 5 years, involving noted scientists from half a dozen fields of medicine.
When these people stand up and say that this is what they found, in all likelihood, the pillars of the establishment will start to shake a little bit anyways. They may still be perceived as slightly off the wall, and maybe they should go back and check their data again. But chances are they're going to catch the interest and imagination of a few anyways who will replicate, and then it'll start to unfold.
Proving ozone can sterilize blood outside of the body is one thing. Proving its potential as a medical treatment is another matter. It takes an average of 11 years for any new drug or treatment to be approved for marketing. Since 1990, Medizone has been unable to finance a study using large animals as required by the FDA before approval can be granted to test ozone therapy on humans. Medizone has run out of money.
We were probably over-optimistic about the timescale involved in commencing clinical trials. It's a little bewildering for us to understand the reluctance of many of the regulatory authorities to approve a clinical trial for a drug that has been on the European markets for the best part of 25 years.
The FDA was asked to comment on Medizone's application.
Or for marketing, we're not allowed to comment on that. Even on the existence of such an application.
The process of putting things through the FDA is so expensive that no small company has a chance. Any small company that wants to put something through the FDA would have to be bought up by a large conglomerate in the pharmaceutical industry. And this, I think, is true in ozone as well. There just wasn't enough money to fight the FDA.
In the FDA, drug companies have representatives on nearly all the committees. If there's something which may be very effective and may undersell the average drug company, of course, they're not going to be very pleased if that gets developed. It might be very difficult for them to compete with that. And ozone is obviously inexpensive to produce. It's very potent. If it works as half as well as the Germans claim it is, everyone should be using it. You know.
Nobody in the pharmaceutical industry can sell ozone. That's a main reason. When we can find a way to sell ozone, I'm sure that ozone is the most important drug in the world.
Despite extensive documentation submitted to the FDA, the agency has publicly condemned ozone therapy. In May 1993, the director of the FDA Office for AIDS Coordination, Dr. Randolph Wyckoff, addressed a congressional subcommittee on medical fraud. He asserted that no scientific evidence exists to support the use of ozone for AIDS. This man believes ozone therapy has saved his life.
They just make it very difficult for a person like myself to do it, but I am so determined that I am going to treat myself regardless of what the FDA wants, or whether, I don't care if they try to throw me in jail. There's nothing they can do. They'd have to throw me in jail first before I would stop, and also stop talking about it.
At an alternative cancer convention in Pasadena, ozone generators are being sold legally as water purifiers. Many will be used secretly for medical purposes. Alternative health care is a rapidly growing field. Ozone therapy is just one of many treatments that are used underground by doctors and therapists. They risk their license in using procedures not approved by orthodox medicine. In the United States, doctors and therapists have been harassed, offices have been raided, and ozone generators have been confiscated.
I will constantly run into doctors saying, well, you know, I've got an ozone machine, but don't tell anybody. I'm doing peroxide infusions, I'm doing ozone infusions, don't tell anybody. Or, well, if you're really sure about the person, tell them they can come see me, that sort of thing. Don't put me in the book, don't put me in the book.
McCabe's book has now sold more than 70,000 copies, and thousands of people have now used ozone.